Welcome to the Maternity Mentor. Today we will be talking about water births, what they are, and why you should consider having one. Stay with us. Hi, I'm Samantha. I'm a board-certified psychiatric nurse practitioner, and I have over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, perinatal mental health certified, and maternal newborn nursing certified. Water births have become increasingly popular in recent years. Let's explore what a water birth is and how to prepare for one. A water birth occurs when you either labor and/or give birth in a tub of warm water. They can happen in the home setting, in a birthing center, or even in a hospital. Women may stay in the tub for their entire labor and delivery once they get in, or they may choose to get in and out of the water. The reason why a woman may choose a water birth is because it is less stressful for her. The birth may also be gentler on the baby because the baby is born into warm water, which is similar to the amniotic fluid the baby was living in for the past 9 months. Both midwives and doctors can deliver your baby during a tub birth. Some may allow for delivery in the water, and others will require you to exit the tub during the pushing stage, so be sure to speak with your healthcare provider about their requirements. There are many benefits to having a water birth, which is why they are becoming so popular. Benefits include being in a soothing, relaxing, comforting environment, receiving increased energy from the water in the late stages of labor, lowered blood pressure, reduced anxiety, more movement due to decreased weight caused by the buoyancy of the water, better positioning, reduced stress hormones, increased endorphins, which provide better pain relief, less need for pain medication, greater sense of privacy, reduced risk of tearing or requiring a episiotomy, improved circulation, improved oxygenation for both mom and baby, more efficient uterine contractions, and a shorter labor. There is not a lot of research regarding the risks of having a water birth, but most organizations, including the Royal College of Obstetricians and Gynecologists and the American College of Obstetrics and Gynecologists, have come out stating risks are rare associated with a water birth. Risks of a water birth include baby's body temperature could become too high or too low, baby could breathe in bath water, baby or mom could get an infection, the umbilical cord could snap before baby comes out of the water, baby could have seizures, baby may not be able to breathe, and the baby could drown. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about contraindications of a water birth. Unfortunately, not everyone is eligible for a water birth. Water births are contraindicated in the following situations: if baby is breech or butt first, if you have herpes, if you're having multiples like twins, if you are having a preterm birth, if you have preeclampsia, if you have an infection, if you have a fever, if you have diabetes, if the baby is really big or you've been diagnosed with macrosomia, if you have a history of a shoulder dystocia delivery, if you've had excessive bleeding, and if there is too much meconium, which is the baby's first poop, in the tub. Some providers may recommend against a water birth if you are younger than 17 or older than 35 due to increased complications that can arise in these populations while giving birth. Finally, if you need constant monitoring while laboring, a water birth is not a viable option. If you are considering a water birth, it's important to plan and prepare in advance. Here are some tips that may help. First, you need to talk with your healthcare provider to see if they offer a water birth and if they are willing to deliver your baby this way. Make sure they are licensed and highly trained to perform this type of delivery. You also want to make sure their covering provider will also allow for a water birth. If your provider agrees, you also need to ensure the birth location, like the hospital or birthing center, will allow for a water birth. Check with your insurance company to see if they will cover the costs of your water birth. Finally, come up with a plan B. Birth is not always a straight path. Things can change rapidly, so it's important to have a backup plan in place in case your water birth doesn't go according to your plan. Here are some tips to help you during your birth. Be sure the tub you use is high quality, well maintained, and well cleaned. Proper infection control measures are a must and should be strictly observed throughout the birth process. The water temperature should be closely monitored and well regulated between 97 and 100 degrees Fahrenheit. Determine the plan for monitoring you and your baby and be sure that is happening during your labor. Have your healthcare provider explain to you reasons why you might need to leave the tub and how that information will be provided to you. Be sure to drink plenty of water during the birth process to avoid dehydration. And finally, don't get into the warm water too quickly because it may slow down your labor. Water births can be a wonderful option for parents to consider when having a baby. I hope this has explained what a water birth is and what to expect when having one. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share our channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.